Good afternoon, and thank you for joining us here today. We are gathered here on the traditional territory of the signatories of Treaties 4 and 7, and I acknowledge the Métis people who share a deep connection with this land. My name is Cathy Hogg. I am the NDP candidate for Cypress-Medicine Hat. I am joined here today by Gwendoline Dirk, the Alberta NDP candidate for Brooks-Medicine Hat, and Medicine Hat residents Vera Gruber and Kinsey Hashi, who cannot find a family doctor. For most of us, our first experiences of health care were at our family doctor's office. We went for routine checkups, to ask questions about our health, and to monitor any chronic conditions. It's where we ask questions, manage chronic conditions, and form relationships with our doctors and the staff. But for many residents in this area, like Vera and Kinsey, finding a family doctor is growing more difficult. Currently, only one family doctor in Medicine Hat is listed on the Palliser Primary Care Network Find a Doctor website is accepting new patients. Without access to a family doctor, families are forced to seek medical care at the emergency room or leave medical conditions untreated until they reach a crisis point. We have seen the effects of this at the Medicine Hat Regional Hospital. Danielle Smith and the UCP have declared the healthcare crisis is over, but we have two Hatters with us today who dare to disagree. I would now like to turn it over to Kinsey. Kinsey?
Thank you, Cathy. I am here today because my family has been without family doctor over 3 years. We had no problem to find doctor when we was moving here 2010, but in now 2020, our doctor decided to move out to Calgary. We have been without family doctor ever since because it's hard to find it. I just cannot find anyone taking my new patient. It looked like a line. I call people, even I drove to Medicine Hat to see if anyone taking new patient, but cannot find doctor to my family doctor in Medicine Hat. Ever I tried to find out an hour ago far away in Brook, but not luck. There is law. We are really don't want to have to make a 2-hour running trip to visit a family doctor. Something must be done to fix this crisis.
Thank you, Kinsey. And I would now like to invite Vera to the mic.
Thank you, Cathy. I had a family doctor for over 20 years. She was amazing, but she decided to change career paths and go into the mental health field to help youth. After she left, it was about 1.5 years before I was finally able to find another doctor. But shortly after I began going to him, he was forced to close his practice. So I was without a family doctor again for a full year. I've had breast cancer twice, and I can't be without a family doctor. A friend who is a nurse at a doctor's office convinced her doctor where she works to see me. That's what it is coming to, phoning in favors with friends to get health care. I am a good candidate to get cancer again, and I don't want to be in a situation where I don't have someone to reach out to. I need a family doctor. This is such a scary situation for me to be in, and I know there are thousands of other Albertans also struggling to find a family doctor. Right now, my husband must drive to Calgary to see a pain management specialist. He has a lot of pain issues, and the specialist he was seeing in Medicine Hat retired a few months ago. Medicine Hat is a city of nearly 70,000 people. Why are there not enough doctors to care for the people who live and work here? It just doesn't make sense. Something needs to be done immediately to end this crisis. I don't think it's a stretch to say people's lives depend on it. Thank you.
Thank you, Vera and Kinsey. for sharing your stories. I've been hearing this all the time from my friends and my neighbors and at the doors. People cannot find a family doctor in the city or in this area, for that matter. But I want you to know that the Alberta NDP are committed to ending the UCP chaos in healthcare, and will do that by building the foundation of primary care. We will do that with what is known as our Family Healthcare Teams Plan. This plan will allow 1 million more Albertans to see a family doctor or other primary care member of a family team within a day or two where they need it. A family team can include multiple family doctors, as well as nurse practitioners, registered and licensed practical nurses, mental health therapists, pharmacists, social workers, dietitians, community paramedics, community health navigators, physiotherapists, midwives, speech language therapists, and so many others. With such a range of primary care professionals, Albertans will receive help with questions, managing chronic conditions, and receiving support to maintain good physical and emotional health. The healthcare workers will have a team to support them to operate in an effective setting, avoid burnout, and manage the patient load in a more efficient way. In fact, there are similar working models in the area. At the Tabor Clinic is one example. There's also one in Calgary. The clinic at Tabor, for example, serves 16. Each doctor is able to take on a higher volume of patients compared to traditional practice, as many of their patients' needs can be looked after by an allied professional. The system actually saves money, too. The Tabor Clinic saved the healthcare system more than $62.2 million over 10 years. This is according to a study done by the Health Quality Council of Alberta. These clinics help Albertans manage their health care outside of emergency waiting rooms, and we can build on this success. With family health clinics, an Alberta NDP government will quickly establish 10 family health clinics across the province. And Medicine Hat will be on top of that list to receive one. Families are deeply concerned about the serious damage caused by Daniel Smith and the UCP to public health care. Even though Daniel Smith is meant to be an elective representative for Brooks Medicine Hat, she has made no progress in supporting access to primary care in this region. The Alberta NDP government will bring a stable, caring, and competent approach to strengthening our public health care, like we are presenting here today. With the family health team model, we can assure that 1 million more Albertans will see a family doctor. We can save our system money in the long run and ensure our healthcare professionals are supported and enjoy working in Alberta again. Thank you. We are happy to take questions now.
All right, thanks, Gwendoline. We'll now go to questions. Before we go to the phones, we'll start with questions in person.
Hi, this is Kendall King with Medicine Hat News. This question is specifically for Gwendoline, but it could also apply to Cathy. Gwendoline, when you had talked about getting a new family health clinic in Medicine Hat, what would you be proposing for the residents of Brooks, also in your district? And how it would apply to Cathy is what would you recommend for like, what do you plan to have for rural residents within your district, but outside of the municipality of Medicine Hat?
That's a very good question, Kendall. I really appreciate it. I actually spoke today with a center in Brooks and found out that, yes, you're absolutely right. They are experiencing exactly the same problem. I can't say any promises at this particular point, but I do know that Brooks is part of my riding, as you said, and that would be something that we would definitely address, because Brooks is a growing city as well, and it needs just as much support as we have here in Medicine Hat. And with the promise, people will have access to a family doctor where they live in a day or two. So that will include all areas in Alberta, even rural areas. But Cathy can speak more to that if she has.
Yeah, I guess I would just add from a rural perspective. I know myself, living an hour out of town, if I have to come to town today to see my daughter, tomorrow to go for a test, the next day to go to another specialist, this kind of one-stop shopping, I think, is something that would very much appeal to our rural residents who can maybe make one trip into town and have all of their needs assessed in that one location, and possibly with a pharmacist right there too, get your pills and go home. And I think it would be a welcome advantage.
Thank you.
All right, we'll go to the phones. Just a reminder for those on the phones to use the *9 function, and for those on Zoom to use the raise hand function. Our first question is from Darren Rathwell at City News. Go ahead, Darren, your line is open.
Hello. I just was wondering, how much more severe would you say the situation is with the lack of family doctors in this area as compared to other regions in the province? Is it more severe? Is it the same? What do you think about that?
Are you talking about other provinces or within Alberta?
Within Alberta.
I would say that this is an issue that is of growing concern across the province. I don't think that we are in a worse situation, but I think every situation is dire and needs to be addressed, and we will be stepping up and proudly welcoming this facility into our area.
Do you have a follow-up, Darren?
I would say that the province talked about how they have a record amount of healthcare professionals currently working in the system. Is that a challenge, finding enough people to fill these roles?
Yes, it will be a challenge, but it is a challenge that we also have a plan for. So first of all, because the working environment will be so much better here in Alberta, we will attract doctors from other provinces. They will have a government they can trust again, and a system that works, and a system that will actually make it so that doctors and nurses and other healthcare professionals won't face the burnout that they're facing. The other thing is that we will attract our students back. In Medicine Hat, I do know out of 9 residencies in primary care, we filled only 3. And so we want to start filling those residency again with young people. We also, part of our strategy is one of the largest recruitment comprehensive plans to attract nurses and doctors and primary care workers to Alberta, in addition to bringing people back out of retirement, where they will want to come back out. They retired early because of burnout. And finally, we have a plan to fast-track criteria and qualifications for foreign-trained healthcare professionals. So that's if you have something to add to that.
Anything further, Darren?
Not at this time. Thank you.
Anything further in person?
How much would one of these facilities cost approximately?
Go ahead, Gwen.
So the cost of the facilities, this is a beautiful part. We will start with expanding on what we already have. And so we have clinics open. Part of the issue is many of these young doctors coming out of practice or ready to practice cannot afford the startup costs. They don't want to be businessmen. They want to do what they've been trained to do. They want to practice medicine. And so clinics that are already open, we can assist them in building on those clinics and bring in more doctors and build a team from that. And there will also be some assistance from government to help build these teams. We also have a plan to build in hospitals, to have hospitals as part of the family health care clinic. So part of the hospital could be utilized as this clinic. It would actually save in emergencies and ICU and situations where they have to call EMSs. Do you have to?
Thank you.
All right, with no further questions, we'll wrap today. Thanks, folks.